Hey everyone, and welcome back to the channel. Today we're talking about something we all think we know, the common cold and the flu. We often hear people say, oh, it's just a cold, or I'll be over this flu in a few days. And while for many of us, that's true, it's really important to understand that respiratory infections, especially influenza, can be much more serious than we think. They're not just a simple inconvenience that keeps us in bed for a weekend. For some people, these infections can lead to severe health complications, hospitalizations, and in some tragic cases, they can be life-threatening. So, let us take a closer look at what's really happening inside our bodies when these viruses take hold and why we should never underestimate them. First, let's distinguish between the common cold and the flu. While both are respiratory illnesses and can have similar symptoms, they're caused by different viruses. Colds are usually milder, giving you a runny nose, sneezing, and a sore throat. The flu, caused by influenza viruses, hits you much harder and faster. Think high fever, body aches, extreme fatigue, and a dry cough. It feels like you've been hit by a truck. The real danger with the flu isn't just these initial symptoms. As awful as they are, the major concern is the potential for serious complications. Influenza can weaken your immune system, making your body a prime target for other, more dangerous infections. One of the most common and serious complications is pneumonia. This is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid, making it difficult to breathe. Pneumonia can be caused directly by the influenza virus itself or by a secondary bacterial infection that takes advantage of your weakened state. Symptoms include a severe cough, chest pain, fever, and shortness of breath. For older adults, young children, and people with chronic health conditions like asthma, heart disease, or diabetes, pneumonia can be particularly dangerous and often requires hospitalization. It's a serious condition that can take weeks or even months to fully recover from. Beyond pneumonia, influenza can trigger a whole cascade of other problems. It can worsen long-term health issues. For example, if you have asthma, the flu can cause severe asthma attacks. If you have chronic heart disease, a flu can increase your risk of a heart attack or stroke. The virus can also cause inflammation of the heart, a condition called myocarditis, or of the brain, known as encephalitis. These are rare, but they are incredibly severe complications. Another serious issue is sepsis, which is the body's life-threatening response to an infection. Sepsis happens when an infection you already have triggers a chain reaction throughout your body, and it can lead to tissue damage, organ failure, and even death. So, what can we do to protect ourselves and our loved ones? The single best way to prevent the flu is by getting a flu vaccine each year. The vaccine helps your body develop antibodies to fight off the virus. It's not a 100% guarantee, but it significantly reduces your risk of getting sick. And if you do get the flu, it's likely to be a much milder case. Besides vaccination, good hygiene is crucial. Wash your hands frequently with soap and water, especially after coughing, sneezing, or being in public places. Avoid touching your eyes, nose, and mouth, as this is how germs enter your body. If you are sick, stay home to prevent spreading the virus to others. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. It's also important to know when to seek medical help. If you have flu symptoms and are in a high-risk group, or if your symptoms are severe, like difficulty breathing, chest pain, sudden dizziness, or a fever that won't go down, it's essential to contact a healthcare professional. There are antiviral drugs that can make the illness milder and shorten the time you are sick, but they work best when started within the first 2 days of illness. Remember, respiratory infections are more than just a seasonal nuisance. Taking them seriously, getting vaccinated, and practicing good hygiene can protect not only your own health but also the health of the entire community. Thanks for watching, take care of yourselves, and don't forget to like and subscribe for more health insights. See you in the next video.